In 1994, I was very excited because we opened a clinic in Fort Morgan. And that too, a 12 exam room site. We became part of the hospital community there. And I'll digress just for a moment because Fort Morgan has always been very special to me. In 1974, the state health department asked me to go to Fort Morgan to give a talk on starting a community health center. I was our director in Rocky Ford at the time, and the people at the health department wanted me to go because I had rural health center credibility, and that's very important when you go to a rural town to talk about things, to be from that environment and to understand what that reality is and what it means. So I went in 1974, and I was impressed by two things. One, it was the first time I'd ever been asked to go give a talk about health centers and what it took to start one. And it was the first time I had to give a talk to a large group purely in Spanish. So it was a challenge in many ways. And when I say a large group, it was probably 40 people, community members, maybe 30. It wasn't huge. But the nice thing was that 20 years later, as the medical director of Salud, completing that circle, I was our medical director and saw patients on the first day when we did open a health center in Fort Morgan. And true to my words, I said, you have to work together with the community. You have to understand it won't happen overnight, but if you keep plugging away, you can make this a reality. And the Salud Families Health Centers made it a reality, and we've been in Fort Morgan now for 21 years this month. The 90s were a time of rapid growth in terms of Salud expanding, hiring more physicians, trying to find the right fit of people that were committed to what we were doing and committed to our patient population, willing to work for less money, willing to have a pretty hectic schedule, knowing that they were part of a very important movement to provide care for the community. That was not and continues to be a very difficult challenge. It was not easy then, it was not easy in the 70s, and now in 2015 it remains an incredibly difficult challenge for us to find that fit and to find a pool of clinicians that want to come and be a part of that. The 90s were also a really important time financially for us. There was much going on. I had done my residency in Fargo, so I was very used to managed care and what that meant, because Minnesota was the cradle of the managed care movement in this country. And I had seen hospitals buy up every private practice within a 100-mile radius of Fargo when I was a resident. That, was retarded in Colorado by 10 or 15 years. So what I had seen earlier was just starting to come to Colorado in the first phase. And that phase didn't take very well. But one of the things that health centers realized was that we had Medicaid patients. In those days, over half our patients were uninsured, and our insured patient was a Medicaid patient. And about 20-25% of our patients had Medicaid. And we realized that managed care would come to Colorado, that they would somehow develop, and if we weren't careful, they would be in control of our Medicaid patients, and we would be what we in those days called bottom feeders. We did not want that to happen. In 93 in Pueblo, at a meeting of the community health centers statewide, we made a decision that we wanted to form our own HMO and our own group.
So the University Hospital provided the funds and some of the staffing and so on to develop Colorado Access. And they had a board of directors, I think it was 9-member board or something, and I was one of those members.
Now, those were big, bold decisions to make and words easy to say, but it was going to be quite a task. And it took us 2 years, but in December of 1995, we had partnered with Denver Health, with the University Hospital, with the Children's Hospital, and with 13 migrant and community health centers. And we formed our own Medicaid HMO called Colorado Access. We had hired someone to be the medical director in November of '95, and we went live. We started taking patients in December. He called 2 weeks into the job from an airport in Chicago and resigned. It was a lot more work than he had envisioned. We weren't sure what was going to happen because we had gone live and we didn't have a medical director. I made the move at that time to become the medical director of Colorado Access, understanding that I would have to take a leave of absence from Salud in order to do that, but also understanding that we needed strong leadership in that position, and we had no time to be looking for someone else and try and get them trained to do the job. I'd spent that year, as I said, as the clinical chair, working with clinicians from all 4 of the ownership groups, knew them all well, had their respect, and knew that I would be able to move into the position and hit the ground, proverbially running, as they say, in order to make us be successful. I realized, however, that long-term managed care was not the place I was going to be. It was a place I ended up for a while to help support what we were doing in the health center movement statewide. But 5 years was plenty, and I came back to Salud in 2001 full-time.